Welcome to Have More Babies. Now, before we get started today, you might be thinking about our show's title. And while Have More Babies definitely brings a smile, today we're looking at something really serious, but incredibly important for keeping those little ones healthy. So get ready, because we are diving deep into something that affects so many families, but is often, well, underestimated: rotavirus. It's common, it's highly contagious, and our mission today is to unpack it, understand its impact, and get you the essential knowledge fast. You can think of it as an unseen enemy lurking in your child's tummy. It's this sneaky invader that can cause way more trouble than you might think. Okay, let's unpack this.
Exactly. And what's fascinating here, just like you said, is how often something's so prevalent. I mean, many parents might just think, oh, it's a really bad stomach bug. It can be so misunderstood.
Yeah.
And that misunderstanding, well, unfortunately, it can sometimes lead to much more severe outcomes if it isn't caught and managed quickly. It's a perfect example of why being informed really is being prepared.
Absolutely. So, to get a handle on this unseen enemy, let's start right at the beginning. What exactly is rotavirus? Our sources say it's a highly contagious virus, actually the #1 cause of severe diarrheal illness in young kids worldwide. It mainly goes after the cells lining their intestines. It's like this tiny army invading their gut. Honestly, the severity can be quite startling for something so common. So the big question then, and maybe the scariest part for parents, is how does this unwelcome guest actually get around? How does it spread so easily?
It's remarkably good at spreading, which is exactly why it was such a huge global problem before the vaccine really took hold. The most common way is what we call the fecal-oral route. Now, that sounds a bit, clinical, but basically it just means tiny microscopic particles of infected stool somehow end up in someone else's mouth. This can happen directly, though that's less common. Usually it's indirect. Think about a child with rotavirus using the bathroom or having a diaper change and then maybe touching a toy.
Right, or doorknob.
Exactly, without really good hand washing. Then another child touches that same surface. And, kids, they put their hands in their mouths. It's an incredibly efficient cycle, almost insidious, especially where young children are grouped together, daycares, playgroups, even just within a family.
So it's not just person-to-person contact then, it's really sneaky.
Precisely. The virus also spreads through contaminated objects, and this is where its environmental resilience is really key. Rotavirus isn't fragile. It can actually survive on hard surfaces, toys, changing tables, doorknobs, even kitchen counters for quite a while, sometimes days.
Please. Wow.
Yeah. So even if something looks clean, the virus might still be there. This resilience is why really thorough, regular disinfection with the right cleaners isn't just like a good suggestion. It's absolutely vital in homes, schools, childcare places to break that chain. And here's something interesting, maybe a lesser-known pathway. Airborne particles.
Airborne, like through the air.
Well, it's not the main way it spreads, but some studies suggest things like flushing a toilet can aerosolize tiny droplets containing the virus, or even just handling contaminated laundry or materials without care could potentially release particles. It just underlines why good ventilation in shared spaces is important too, along with the hand washing, especially in places like public restrooms. If we connect this to the bigger picture, it really highlights why simple hygiene, done consistently, is just so vital against this kind of invisible opponent.
That environmental resilience part definitely makes you think twice about everything your toddler touches and then puts in their mouth. Makes you want to double wipe everything.
Okay, so once this stealthy invader gets inside, what does it actually do? Our sources are clear. It's way more than just a tummy ache. This is where it gets really interesting, because the symptoms are pretty distinct and can escalate fast. So beyond that severe watery diarrhea, which sounds just awful, so frequent parents should look out for severe vomiting too, right? Often happening a lot. Yes. And a high persistent fever often comes along with it. Plus, abdominal pain that can range from just a sort of dull ache to really intense cramping.
That sounds like a miserable combination.
It is. And that combination is what makes rotavirus so potentially dangerous, especially for babies and toddlers. The absolute most critical danger, the thing every parent needs to be watching for, is the quick onset of severe dehydration.
Because they're losing fluids so fast from both ends.
Exactly. From the vomiting and the diarrhea, their little bodies just can't keep up. And the speed dehydration can set in is, frankly, alarming. So parents need to know the signs.
Yeah.
We're talking things like fewer wet diapers or no wet diapers for several hours.
Right.
A really dry mouth and tongue, maybe no tears when they cry, sunken-looking eyes. Lethargy is a big one. They seem unusually sleepy or unresponsive. And in babies, you might notice that soft spot on their head seems sunken.
Those are definite red flags.
Absolutely. Any of those signs need immediate medical attention. Severe dehydration can become life-threatening very quickly if it's not treated.
That sounds incredibly stressful. Knowing those signs really does empower you to act fast. So, if a parent suspects rotavirus, what happens next? How do doctors figure it out, and what's the immediate plan?
Right, knowing the symptoms is step one. For diagnosis, it usually involves a stool test. A sample is checked specifically for the rotavirus itself. But alongside that, the doctor will do a thorough review of the symptoms and the child's medical history. That helps rule out other stomach bugs that might look similar, making sure they choose the right treatment path.
And the treatment? Is it just waiting it out?
Not exactly. The absolute primary focus, I really can't stress this enough, is rehydration. Because the body's losing so much fluid and important salts, electrolytes, the goal is to replace them fast. Oral rehydration solutions, or ORS, are key here. These aren't just juice or water.
Right, those special electrolyte drinks you can get.
Precisely. They have a specific balance of salts and sugars designed to help the intestines absorb fluid efficiently. They work much better than plain water, and definitely better than sugary drinks, which can sometimes make diarrhea worse. Diet-wise, once the child can keep things down, bland foods are usually best. Think bananas, rice, applesauce, toast the brat diet you often hear about.
Yeah.
Easy on the tummy.
Okay.
But in more severe cases, if the child can't keep oral fluids down or if they're already significantly dehydrated when they get to the doctor, hospitalization for intravenous fluids might be necessary. That way, fluids go directly into the bloodstream. So this raises an important question. Knowing these symptoms, knowing the risk of dehydration, how quickly should parents act?
Immediate, it sounds like.
Immediately, especially with severe vomiting, constant diarrhea, or if you see any of those dehydration signs we talked about. Don't wait and see. Call your pediatrician right away.
That's really clear advice. Early action is key with something that moves so fast. Okay, so given how tough this virus is, what about prevention? What does this all mean for keeping our little ones safe in the first place? Thankfully, we do have a really powerful tool, the rotavirus vaccine. Our sources call it a game changer, and that feels right. It's really changed the landscape of childhood illness, seriously cutting down severe cases. It's part of the standard vaccine schedule in many places now.
It really is a massive public health success story, and its impact goes way beyond just protecting individual kids. It has this significant, often kind of hidden impact on global health. Before the vaccine was widespread, rotavirus was a huge killer of children under 5, especially in developing countries.
Wow, I didn't realize it was that severe globally.
Oh, yes. And think about the economic burden, too. You've got the obvious direct medical costs, hospital stays, doctor visits, medicine tests. That can be a huge strain on families, even with good insurance. But then there are the indirect costs, parents missing work to care for a sick child, lost wages, maybe even job worries. And this whole burden is just magnified in developing countries. Limited healthcare access often means kids get much sicker before they get help, leading to longer hospital stays and, tragically, higher death rates. Imagine a family already struggling, then facing those costs, plus the emotional toll.
It paints a really stark picture of just how wide the ripples spread from this one virus.
It really does. And while global vaccination efforts have made incredible progress, we've seen huge drops in severe disease, there are still challenges in getting the vaccine to everyone everywhere. Disparities in healthcare systems, logistical hurdles, sometimes vaccine hesitancy, it all leads to uneven protection around the world. Some places still struggle to reach every child.
So there's still work to do.
Definitely. It highlights why we need these ongoing collaborative initiatives, governments, international health groups like the WHO, private companies working together not just to develop vaccines, but to make sure they get distributed fairly. What's fascinating here is how a simple vaccine, given at the right time, can have such a profound global ripple effect. It saves lives, yes, but also saves huge amounts of money and prevents so much family suffering. It's incredibly cost-effective.
It really does shift your perspective thinking about the global scale of what might seem like just a common childhood bug here. But science doesn't stand still, right? It's not just about what we know now, but what we're learning. What's happening on the research front? What's the future look like for tackling rotavirus?
That's a great question. The scientific community is always delving into the genetic makeup because rotavirus shows significant genetic variability. It's sort of like the flu virus in that way. There isn't just one single type.
So it keeps changing.
Exactly. There are multiple strains circulating around the world, and these strains can mutate or shift over time. Understanding this diversity, how the virus changes, is critical for making sure our vaccines stay effective. Researchers are constantly checking if current vaccines cover new variants, or even working on next-generation vaccines for broader protection. This genetic variety can also subtly affect how severe the symptoms are, which makes developing one-size-fits-all treatments a bit tricky.
So it's like trying to hit a moving target.
In a way, yes. And that leads to another really interesting area, potential long-term consequences. We mostly think of rotavirus causing that acute, nasty stomach flu. But newer research is looking beyond acute symptoms. For example, some studies hint at possible malabsorption issues later on.
Meaning trouble absorbing nutrients.
Right. Even after the infection is long gone, the intestines might struggle to absorb nutrients properly, which could potentially affect a child's growth. There's also ongoing research into immune system modulation. Basically, the idea that the virus might tweak the body's immune defenses in some way, possibly with lasting effects on how the child responds to other illnesses down the road.
Wow, that's complex.
It is. Recognizing these longer-term, sometimes subtle impacts is really important for developing healthcare strategies that address the whole picture, not just the immediate sickness. And then there's what feels like a new frontier: antiviral therapies. Researchers are actively looking for medicines that could directly attack the rotavirus itself, not just manage the symptoms like dehydration.
Like an antibiotic, but for a virus.
Kind of, yes. Specific antiviral drugs. This could be huge, especially for kids who get severely ill or have weakened immune systems. And finally, there's genomic surveillance. This is super important. It means constantly tracking the genetic changes in rotavirus samples from all over the world. It helps researchers stay one step ahead, basically, adapting vaccines and treatments as the virus evolves. It's like a global early warning system. If we connect this to the bigger picture, it really underscores why this ongoing research and strong global teamwork are absolutely non-negotiable in the fight against rotavirus. We have to keep innovating.
That's just incredible insight into such a tiny virus with such a potentially huge impact. Makes you appreciate all the work going on behind the scenes. So, okay, with all this amazing evolving information, let's bring it back home. What can you, listening right now, do? As a parent, as a community member, our sources really stress the importance of public awareness and education. It's not just about what the experts know, but what we all understand and practice.
It's exactly right. Public involvement is key. First off, actively promoting vaccination in your own circles, in your community, is powerful. That means maybe sharing good information, supporting campaigns that highlight the vaccine's safety and importance, helping to break down barriers by tackling myths with facts. Good coverage protects everyone.
Makes sense. Strength in numbers.
Definitely. Second, never underestimate basic hygiene practices. It sounds simple, but it remains a simple yet powerful tool. Maybe the most accessible tool we have. We're talking diligent hand-washing soap and water, at least 20 seconds, especially after bathroom use, changing diapers, and before handling food or eating. Plus, keeping surfaces clean, safe food prep, all those fundamentals. These are things individuals and families can do right now.
The basics really matter.
They really do. And third, community engagement makes a difference. Getting communities involved in health decisions, supporting local health programs, building that sense of collective responsibility for keeping kids healthy. When healthcare providers and the public work together, prevention efforts are just so much more effective. Your actions, combined with others, build a strong defense.
So as you go about your week, maybe consider that. How empowering yourself, your friends, your community with this knowledge about rotavirus can help build a more rotavirus resilient future for all kids. It's about being informed, proactive, and part of that solution. Wow. Okay, we have covered a lot of ground today. We looked at what rotavirus is, how this unseen enemy spreads, the symptoms to watch for, why immediate treatment, especially hydration, is so critical. We talked about the amazing impact of the vaccine, the global picture, and even the cutting-edge research happening right now. This really shows how vital knowledge and prevention are for keeping our children healthy and how we can all play a part. Now, for more details, specific resources related to rotavirus, or to book an appointment if you have any concerns at all about your child's health, please visit omegapediatrics.com. Let me spell that out for you. That's omegapediatrics.com. omegapediatrics.com. Please do check out the information there. And if you found this conversation valuable today, we'd really appreciate it if you could take a second to like this video, subscribe to our channel for more discussions like this, and please share this video with other parents, caregivers who might benefit from knowing more about rotavirus. Your support really helps us get this important information out to more families.
Absolutely, because knowledge truly is power, especially when it comes to our children's health. Being informed and proactive lets us navigate these challenges with much more confidence.
Well said. Thank you so much for joining us on Have More Babies for this important discussion. We look forward to sharing more insights with you next time. Stay curious, stay informed, and most importantly, stay safe. Goodbye for now.